couldn't sit, I couldn't lie down, I couldn't sleep, couldn't walk, just in misery.
It was extreme, excruciating pain, debilitating pain. And because I worked part-time as my choice as a critical care nurse, I was able to push my body to do what I needed to do on the days that I worked. And the rest of the time, my bottom was on an ice pack and I was in a supine position. No one wants to go to surgery when there's no guarantee. And I don't think you get a guarantee in this life as such.
You're looking at Vax D therapy, a clinically tested and medically proven non-surgical alternative for low back pain. Vax D has successfully treated patients with low back pain without hospitalization, scarring, and other complications common to back surgery. In a nationwide clinical study involving 778 patients, this FDA-approved treatment was shown to be effective in 71% of the patients who were treated by it. The results of this study were so dramatic that stories about Vax D's effectiveness aired on more than 230 newscasts nationwide.
Tonight's Health Check, help for your aching back. 85% of us suffer from some sort of lower back pain, and for many, it leads to surgery. But now a new therapy may help ease that pain without a visit to the operating room.
If you suffer from back pain, a new treatment that doesn't require major surgery could have you doing back flips.
Oh, our aching backs. Researchers tell us the most common complaint we all have is back pain.
A new study shows a treatment called Vax D can help without any surgery.
Is your back aching? If so, you're not alone. 85% of Americans suffer from lower back problems, but a new study finds a non-surgical solution. It's called Vax D therapy, and researchers found it to be effective in relieving back pain in 71% of the 800 patients studied.
Our study evaluated pain on a scale from 0 being no pain to 5 being very severe pain. 92% of patients felt that there was some improvement in their pain. Our criteria of considering the patient having been successfully treated with Vax D therapy required that their pain dropped to a level of no pain or very minimal pain, thus a 1 on our scale of 0 to 5. Of those patients treated with Vax D, 71% overall had a successful treatment with Vax D.
Why is Vax D so effective? Vax D is so effective because it treats the underlying causes of the pain and not just the symptoms. Your spine is made up of bones called vertebrae, which protect the spinal cord, the central nerve of your body. These bones are cushioned by shock-absorbing structures called discs. These discs, however, are often the source of back pain.
As our spines degenerate over time, we see that the shape of the disc is affected, that the bulging is more prominent, and because of that, the height of the space that the nerve root has to come through deteriorates over time, and more strain. Disc, a herniated disc, the disc itself ruptures backwards and out to the side, or posterior laterally. And the traversing nerve root can be affected, as well as the nerve root descending that will come out the next hole from below.
The ruptured disc can place pressure on the nerves, causing excruciating pain. Vax D therapy gently stretches the lumbar region of the spine, reducing pressure on the injured disc and relieving the patient's pain and symptoms. Unlike surgery, Vax D requires no anesthesia, has no lengthy recovery period, and is virtually pain-free. Vax D therapy is the only therapeutic device to achieve non-surgical decompression of the lumbar spine, which allows for improvement of the herniated disc and relief of pain. Vax D was created by Dr. Alan Dyer, the former Canadian Deputy Minister of Health, who pioneered development of the heart defibrillator.
It's a treatment that should be tried before back surgery. It doesn't say it's replacing it, it just makes common sense to try a non-invasive procedure that's been proven in recent studies 70% of the time in patients with chronic low back pain and degenerative disc diseases and so on, been proven to be successful in 70% of the time. And so it just makes sense to try that before one does resort to surgery.
Patients begin each 30-minute VaxD session by being secured in this special harness, which concentrates the treatment on the lumbar spine as the VaxD therapeutic table separates at 60-second intervals. The precise controls measure the exact rate of stretching to maximize the effectiveness of VaxD for each individual patient. The patient has the freedom to release at any time, stopping the procedure.
Well, the beauty of it, I guess it was just so easy to do. It felt wonderful while you were doing it. It's changed my life completely because I'm just completely pain-free. Can do everything that I did before.
This is the first treatment that I have had that left me pain-free.
Clinical research has shown that VaxD is a safe, effective treatment for low back pain. These MRI images show the dramatic effects of VaxD therapy.
Ms. Cook had an MRI scan done on March 31st, 1997, showing a substantial disc herniation at the disc between the 5th lumbar vertebra and the 1st sacral vertebra. Our next study was on March 14, 1998, and this is following a series of VaxD treatment. We see a substantial involution or a sucking back of the disc to reduce that disc herniation.
I took 12 sessions with relief, a good bit of relief, nominal pain medication. I had never had to stay out of work, was able to maintain a normal living schedule. Within a year of that time, I came back to the surgeon to see what possibility I could expect of pain relief for the rest of my life, and he recommended another MRI, and the MRI showed that there was a decrease in the herniation, and at that point he couldn't recommend surgery because it wasn't justified or needed. So I'm very happy with the therapy.
There's one specific area that surgery cannot really address until the person's condition is so severe that all that can be done is to try to fuse the spine. We're able to offer patients that are suffering from severe back pain on the basis of disc degeneration, give them hope and give them a true treatment option that was not previously available to them.
VaxD is a proven treatment that has been helping people with herniated discs, degenerative and bulging discs, sciatica and Fayette syndrome in the United States, Canada, and Puerto Rico since 1989. It costs 1/10 of what typical back surgery costs, has no risk of surgical complications, and doesn't create dangerous scar tissue that can cause pain later. If you're suffering from a herniated or degenerative disc, sciatica, or other chronic low back pain, ask your doctor about VaxD. With VaxD therapy, there's no surgery, no long recovery time, and no more pain. With VaxD therapy, there's no reason to suffer anymore.
Not too long after the treatments, I woke up one morning and I kept thinking something is wrong, something's just not right. And then it hit me because I wasn't in pain. And that was the first morning that I can remember waking up that I wasn't in pain. And it's a wonderful feeling.